study. This is an ultrasound study of a female aged 40 years and presented with fever with rigors and severe pain in the right hypochondrium for the last 4 days. Now this is the liver, this is the left lobe in longitudinal section. Here we see both right and left lobes. The angle is sharp. The angle is rounded. The angle is rounded. I can see the liver below the costal margin. Here I am giving a sweep to the liver below the costal margin and I can see the liver parenchyma. Here we see the kidney in transverse section and the hilar region as well. Now when I move the probe in the intercostal space to evaluate the status of the gallbladder with patient in supine posture, I can see there are multiple calculi within the lumen of the almost collapsed gallbladder. Now this is the anterior wall of the gallbladder and these are the calculi with sharp posterior shadow obscuring the posterior wall, and this is the posterior part of the gallbladder. So body contains large pulsatilage calculi. The largest is 15.9 or 16 millimeters. Now patient in left lateral decubitus posture, evaluating the gallbladder, focusing on the gallbladder. It's okay that we are seeing that there are calculi within the lumen and the wall is thick. Patient is with fast, overnight fast, and we do see that the lumen is collapsed on a small amount of bile over here is seen. These are the calculi, this is the fundal region, this is the posterior wall, upper part of the posterior wall, and this is the anterior wall. This wall measures approximately 4.4 millimeters and is enlarged. Well, this is the portal vein, this is the common hepatic artery, and this is the common bile duct. The common bile duct measures 4.1 up to 7 is considered to be normal. So the CBD is now dilated with this pathology. So here we see there is thickness of the gallbladder wall. This is the gallbladder and these are the calculi. Portal vein is normal in caliber, patent CBD is normal, but adjacent to the gallbladder lower part, here we see, this is the, now you see, anterior wall of the gallbladder attached or relating to the anterior wall of the gallbladder. This is the anterior wall of the gallbladder. This is the small amount of bile in the lumen of the gallbladder. These are two calculi seen, and extend here if you see a breach is seen, small amount of, a small breach is seen here. Focus in this region, and from this breach what we see is a collection is seen measuring approximately 5 into 4.5 centimeters, and not only this, in this collection you can see there are different strength internal echoes, and there is heterogeneity of this fluid collection, and you can see the posterior wall acoustic enhancement from this collection, suggesting that this is an abscess formation post cholecystitis, acute cholecystitis. So acute cholecystitis, cholelithiasis with abscess formation in the pericholecystic space, and it is not relating to the liver. And one of the indications that this is in fact a cystic mass is that you can see the posterior wall acoustic enhancement and cystic areas. A few tiny echogenic particles are seen within it, and this relates. We cannot separate it from the anterior wall of the gallbladder, the lower anterior wall, possibly GB neck region. So this is the gallbladder. Sorry, the collection, possibly abscess in a patient with cholelithiasis, thick edematous GB wall, and small amount of bile that you can see within this almost contracted gallbladder, a post-meal contracted gallbladder. This is an abscess. Due to breach in the wall of the gallbladder in this location. Here we see, now this is the transverse section of the gallbladder, and you can see the medial extension of the and you can see the kidney, the gallbladder. Now in this view we can see the transverse of the kidney. Here we see the gallbladder. This is the gallbladder. This is the calculus giving shadow, and this is the collection. Here you see the collection can be seen extending in the hepatorenal angle. This is the kidney. This is the liver. This is the hepatorenal angle, and we see fluid in the hepatorenal angle as well. Not only this, we do see a few cystic areas extending in the Morrison's pouch, along with this small amount of fluid. So this is in fact a case of acute cholecystitis with perforation and collection of material, that is an abscess with extensions. Now this is a small cystic extension that relates to this abscess or collection, safer word, collection. This is the transverse section, the gallbladder, the calculi. Now this is a case of acute cholecystitis with cholelithiasis due to perforation of the GB wall. Here you see a bit better, and you to see the perforated area. This is the area, the perforated area, and this is the collection with echogenic areas within it. And this is a case, a collection / abscess and the pericholecystic space with small amount of fluid in the hepatorenal angle, along with cystic extensions in the Morrison's pouch. So this is the case of the day. Thank you very much.